Today marks the beginning of a very meaningful partnership between Tulane University and Blue Cross and Blue Shield of Louisiana. In short, there is a health crisis in this state. We have a corporate mission of improving the health and lives of Louisianans, and we feel that this partnership is going to amplify our ability to do that. It's going to become a very meaningful partnership to address population health in this state and beyond.
The partnership is all about finding projects of mutual interest for Blue Cross Blue Shield and for Tulane University.
Part of my presentation is to show how we use data and the analysis of data to help our customers understand what steps they can take to improve not only their healthcare costs, but also the health of their employees.
We happen to have a large cache of health-related data, which we will be making available to Tulane researchers and faculty. We'll enter into partnerships in research. There'll be joint applications for grants. There'll be a number of activities all related to studying and improving population health in the state.
Well, in the end, it's all about healthcare innovation and trying to make improvements upon access to healthcare, access to wellness for the citizens of Louisiana and beyond.
The average person will benefit through a coordinated effort of both entities identifying where we can create new benefit programs by developing programs for employers that will overall help to improve health and lower healthcare costs.
Today we talked a little bit about possible partnerships with Tulane. We are actually very interested in these partnerships. My work at Blue Cross is all about attracting, retaining, motivating employees. We have about 2,500 Louisianians that work at Blue Cross, and we see a partnership like this as a good win-win or a great win-win kind of partnership. It allows us to kind of build our business through innovative thought processes with students, but it also allows Tulane students entries into a large organization, expand their skill sets, and do some indirect learning.
Thank you all for joining us today to learn more about an exciting new partnership between Tulane University and Blue Cross Blue Shield of Louisiana. I'm Robin Foreman, Senior Vice President for Academic Affairs and Provost here at Tulane, and I'm delighted to have the opportunity to say a few words this afternoon. I've got to say, in all sincerity, this event has some special meaning for me. As I was just saying, I've been at Tulane in the role of provost for all of about 6 weeks now. Tomorrow is my 6-week anniversary. And I came here because I believed then, 6 weeks ago, as I believe now, that Tulane is uniquely able to address some of the most pressing issues facing our communities, because these issues don't align themselves neatly with the traditional academic silos. They don't live neatly within any one school or one department. So I was attracted to Tulane first by President Fitt's emphasis on interdisciplinary work, what he calls crossing boundaries. But that said, president's words are just the president's words. Presidents say all kinds of things. So that's not what really got me here. I'm here because the more I learned about Tulane, the more clearly I could see that across Tulane's campus, across Tulane's history, bringing communities together to solve big problems is what Tulane does and what Tulane has always done. Tulane began by connecting medicine and public health in response to a yellow fever epidemic almost 200 years ago, and that's the real story. Tulane was founded to solve problems and has always done so by crossing boundaries. So if you look at the Tulane campus today, we see remarkable, intensely interdisciplinary communities of Tulane scholars partnering with others around the globe, inside and outside of academia, to unravel the mysteries of the human brain, to end cycles of community violence, to build more resilient cities, and this list could be continued at great length. By bringing folks together at Tulane, we are working harder on these issues than others are, but we're also working and thinking in new ways. We're asking new questions and discovering new paths forward. And that really is the point. We're working and thinking in new ways. So you can see our physicians going beyond clinical practice and research to address international health, public policy, public health administration, healthcare administration and consultation, and practice management. You can see our School of Science and Engineering faculty bringing basic science and the maker culture of engineering together seamlessly to translate new ideas into new inventions and then to bring these innovative products to market. And you can see our social workers utilizing digital media and computer science in an effort to identify how we can harness technology to fight addiction, mental illness, and domestic violence. And we're leading the way in educating a new generation of leaders as we develop programs that prepare students to carry on this innovative and important work. Taking just the example of our School of Medicine, our joint MD, Master of Public Health degree program integrates medical education and public health to provide the foundation for a better understanding of both individual and population-based health needs and how these two perspectives inform each other. Our medical students can also earn an MBA alongside their MD, tearing down the old wall between hospital administration and frontline care providers and building bridges to new paradigms in its place. And all of that brings me to why we're here today. The Blue Cross Blue Shield of Louisiana and Tulane University Partnership for Healthcare Innovation. When I speak about the most challenging problems facing our communities, any such conversation should start with the most global, most universal challenge, that of supporting a healthy population. And this is also an example of a problem that is not going to be solved by working one department at a time or one school at a time. The healthcare industry is going through a period of intense change as providers, payers, politicians, and other stakeholders struggle with the fundamental question of how to deliver effective, accessible care for everyone and keeping costs affordable. And we must do that while dealing with changing regulations and expectations, exploring the role of new technology, and dealing with the ever-evolving health challenges. And here I'm using the word evolution, both in its metaphorical and in its literal sense. Continually evolving health challenges facing our population. We learn more about how to respond effectively to one concern, only to see another emerge in its wake. And we must do all of this within the extraordinarily complicated framework of the $2.9 trillion healthcare industry. Researchers all across Tulane are exploring facets of these challenges, and this new partnership will combine their ideas, questions, and analysis with the deep expertise and experience at Blue Cross Blue Shield of Louisiana to strive for innovative insights and solutions. Before we start the program, I'd like to take a moment to acknowledge all the folks in Blue Cross Blue Shield who are joining us today. Please stand if you're from Blue Cross Blue Shield. And please join me in thanking them for their participation in today's event and in the partnership. Thank you. Thank you very much. Thank you for your support, and also thank you for your brilliant insight in selecting Tulane as the right partner for this endeavor. I'm really very excited to see where this partnership leads and what silos we can break down together. I'd also like to thank the folks here from Tulane, from the various schools who have come out today. We have administrators and faculty from medicine, business, public health and tropical medicine, social work, liberal arts, and science and engineering. And I've also seen some folks from university-wide units, including Office of Research, Technology Transfer, Career Services, and the Center for Public Service. And as John was just saying, the broad interest in this work and the broad commitment to this project is a large part of why I'm so excited by the possibilities and so confident in its future. So, without much further ado, I'd like to invite John McGinnis, Vice President for Corporate Communications at Blue Cross Blue Shield of Louisiana, to tell you more about this exciting venture. John?
Our corporate mission at Blue Cross and Blue Shield of Louisiana is to improve the lives and health of Louisianans. What better way to do that than by partnering with Tulane University, one of the premier academic institutions in the country. We feel this is going to be a mutually beneficial partnership, but the true beneficiaries are going to be the citizens of this state and beyond. I'd like to offer to you just a small sampling of health-related data about Louisiana that comes from the Trust for America's Health and the Robert Wood Johnson Foundation, because I think it's highly illustrative of why we're here talking about this partnership today. Louisiana has the highest adult obesity rate in the nation at 36%. Our state ranks number 4 in obesity for children ages 10 to 17 at 21%. We're number 5 in adult diabetes, number 4 in hypertension. According to the Trust projections, we could see more than 1.2 million cases of heart disease and 170,000 cases of obesity-related cancers by the year 2030. Also, according to the Kaiser Family Foundation, Louisiana is 3rd worst in the rate of infant deaths, only after Mississippi and Guam. And we're 5th worst in the heart disease death rate. Clearly, there is a health crisis in this state, and to a lesser degree perhaps, but still a significant degree across America. The health crisis extends to high costs. According to the U.S. Centers of Medicare and Medicaid, Louisiana has 6 of the 10 highest spending Medicare markets in America, with Monroe at number 3 in the nation, Alexandria 5, Lafayette 6, Shreveport 7, Baton Rouge 8, and Metairie 10. For these very compelling reasons, Blue Cross and Blue Shield of Louisiana and Tulane University are coming together with a unified mission of transforming healthcare in this state and beyond. Working together, we must and we will discover innovative ways to improve the quality of healthcare while holding down costs. Both of our institutions have made steps in this direction, but I can only imagine the progress we'll make when we work together. To quote our president, Steve Udvar-Hai, the healthcare system in the United States is broken, and it cannot be fixed by one entity alone. It will have to be done in a cooperative effort among health insurers, the provider or medical community, businesses, and concerned individuals. And now to that list we add academia, as we, the largest health insurer in the state, enter into a partnership with one of the most respected universities in the country. I'm aware of only one other partnership between a Blue plan and a university. It's between Highmark Blue Cross, headquartered in Pittsburgh, and Carnegie Mellon University. It's a very mature partnership, and I think we can look to it for guidance as we begin to mature our partnership. You'll notice I just used the term Blue Cross plan. Let me take a minute to explain to you what a Blue Cross plan is and how it fits into the National Blue Cross system. There are 36 independent Blue Cross and Blue Shield plans across the nation. Each one is an independent company licensed by state governments and run by local boards of directors. Collectively, the Blue Cross and Blue Shield plans across the United States insure more than 107 million Americans, or about 1/3 of our national population. Blue Cross and Blue Shield of Louisiana is Louisiana's oldest and largest domestic health insurer, founded here in New Orleans in 1934. We serve 1.6 million customers. That's about 1/4 of the residents of the state. We're private, fully taxed, a nonprofit company owned by our policyholders, not by shareholders. We're Louisiana-owned and operated, governed by an independent Louisiana Board of Directors, and do business only in Louisiana. Our company employs 2,500 Louisianans throughout the state. Our headquarters is in Baton Rouge, and we have regional offices in Alexandria, Houma, Lafayette, Lake Charles, Monroe, Shreveport, and here in New Orleans. Every full-service acute care hospital in the state, nearly 9 out of 10 physicians in the state work in Blue Cross networks here. We promote, invest in accountable, coordinated, and collaborative care through our Quality Blue programs, which are designed to assist Louisiana doctors in providing better care for their patients and to reward those with proven track records of improving outcomes. Dr. Rob Mascalis, our Medical Director of Care Transformation, will tell you more about those programs in a minute. That's about all I have this afternoon, but before I sign off, I would like to thank a few people who have dedicated their time and energy to shaping this great partnership. It didn't spring up overnight. It was a result of conversations and meetings and idea exchanges and emails over 2 years. I'd like to thank Ira Solomon, Dean of the Freeman School of Business, and in particular Paul Spence, Senior Associate Dean of the Freeman School, for their early encouragement and the time they gave to discussing and promoting it. I'd also like to thank former Provost Michael Bernstein, who hosted the first major meeting between Blue Cross representatives and Tulane deans in December of 2014. This led to a memorandum of understanding being signed in 2015. And for more recent efforts, Dr. Tim Harlan, Assistant Dean for Clinical Services, Melissa Erickson, Executive Director of Corporate Foundation and Research Relations and Development, and Ryan Meck, Senior Development Officer. All have been tireless in their support and enthusiasm. This has been a long and winding road, and it couldn't have been done without a lot of support on the Blue Cross side as well, from our former president, Mike Reitz, and our current president, Dr. Stephen Udverhey, and the team you see here today. Are there questions at this point? If not, I'd like to introduce Michael Tipton, president of the Blue Cross and Blue Shield Foundation.
I'd echo the remarks from just a few minutes ago that we are incredibly thankful for the great team here at Tulane and excited for this partnership to work on behalf of people throughout the state of Louisiana. I'm the president of the Blue Cross and Blue Shield of Louisiana Foundation, which is an independent grant-making foundation created and funded by the leadership at Blue Cross. We make grants to focus on children's health and education-related causes throughout Louisiana, with the mission of promoting wellness and well-being in our state. I similarly serve as the head of Blue Cross's community relations team, which means I oversee our company's giving to support nonprofit and community efforts throughout the state. In both of those cases, I've had the benefit and opportunity to get to see the powerful role that universities can play in partnership to solving problems throughout the state. And so I'm personally very excited to be here today to see the ways that we can work together for the benefit of the people of Louisiana. Over the next few minutes, you're going to hear from a number of us at Blue Cross about the work that we are doing at a fairly high level. That is designed to try and give you a sense of the scope of our work and the things that are already underway, in the sense that you might be able to connect with something that is currently in process, but also to give you a sense of ideas and things that we might have available that could prompt new ideas for you going forward. A few of your colleagues came up to Blue Cross a number of weeks ago to give us an overview of all the things that Tulane has to offer so we can get our wheels turning, and we wanted to do the same to be able to come and visit with you all today. All that to say, when you're listening to any of us talk, if something is of interest, please jot it down, circle a name, and make a point in either one of the breakout sessions, which we'll go through more of the logistics in a moment, or in the reception later. Please come find us. We'd love to be able to engage with you and have follow-up conversations. Before I hand off the remarks to my colleague Peter Lee, I'll tell you a bit about what we do at the Blue Cross Foundation, as well as what we do in our community relations efforts. Start with the company side, our community relations efforts. So we do a number of things for the benefit of our community broadly. So first, we sponsor community events. You have probably seen our logo out and about at things ranging from conferences to races and runs here in the New Orleans community. To name just two that are happening here in the next couple weeks, the Jazz Half Marathon that I imagine at least a few folks in the room will be at, we are a sponsor of, as well as a conference that Tulane is sponsoring in December, the Retrovirus Research Conference happening here in December, are two things we are proud to be a sponsor of. Second, we have employees who volunteer. They want to find ways to give back to community events. You heard John mention we have roughly 2,500 employees here in Louisiana. We have folks who are dedicating of their time and their energy to volunteer and give back at everything from those races and runs to Habitat for Humanity builds, you name it. We have employees who give of their own dollars, and we have a matching gifts program. So if somebody is personally passionate to give back to their college at Tulane or a particular nonprofit in the community, we want to match those dollars and be able to invest in powerful ways. And then finally, on the company side, we work to identify new and we think mutually beneficial community partnerships. Things like what we are here to talk about today, but also many other opportunities with nonprofits throughout Louisiana. On the foundation side, we do a number of things that you all might be familiar with. We run a program called the Angel Awards. So we actually had our gala on Monday evening. That is an award that is designed to highlight people who go above and beyond in support of Louisiana's children. At least 2 of this year's honorees have deep connections to Tulane, including one of whom was highlighted just a few weeks ago in one of your magazines. And we were glad to be able to highlight her, as well as the other leaders from New Orleans and throughout the state who are doing incredible things, highlight them and invest some dollars to support their work. We also run a series of grant programs, a grant program designed to focus on innovation that is designed to encourage nonprofits to come up with new and creative ways to solve what seem like intractable problems. We have a special projects grants programs that are designed to do one-time investments of dollars to encourage special projects, whether it be a bike share program here in New Orleans or completing various other walking and biking trails. We want to be able to invest some dollars to help make Louisiana a healthier and stronger state. And finally, we have a collective impact grant program, which is designed to invest dollars and encourage collaboration in a way that can improve health and quality of life by tackling big issues, whether it be obesity, access to mental health care, early childhood formation for low-income children. We want to encourage groups to work together and be able to invest some dollars to try and support groups working together to solve those big and seemingly intractable problems. Finally, I'd just say related to those collective impact grants and where it specifically relates to work we do with universities, we are very committed to finding what works, to investing in what works, to stop doing things that do not work, which means we need a base of research and intellect that can help point us in the right direction. So we are certainly always looking for researchers that might be able to help point out best practices and help us evaluate the effectiveness of that work. So I'll close my remarks and then turn it over to my colleague by reiterating this. Blue Cross is a locally owned company. We live here in Louisiana, we work here in Louisiana, and we seek to give back to Louisiana. When you put all of the Blue Cross plans together, this is one of the most generous companies in America because they're separated into 36 different companies. It doesn't often get framed that way, but you can put Blue Cross up against any corporation anywhere in America, and we are giving more than just about anyone that you can name. We are proud of that. That is part of our commitment to improving health and quality of life in this state and states across the country. And I certainly would look forward to talking to you all about how we want to live that out in our work, in the breakout session later, at the reception later, or in any other way in the days to come. So with that, I'm going to turn it over to my colleague, Vice President of Healthcare Analytics, Peter Lee, to tell you a bit more about his work. Peter?
As John stated in his introductory remark, Blue Cross Blue Shield Louisiana serves 1.6 billion people. And that provides tremendous opportunity in understanding how healthcare is delivered, managed, and coordinated. When we profile our population, 85% of members have, on the average, 2 different diseases, see 3 different providers, which may include physicians, labs, hospitals, and imaging centers, and whatnot. The top 15% of our members have 6 different disease conditions and see 11 different providers. Additionally, the top 15% of these members, their expenditure is 8 times the lower 85%. So this provides a tremendous opportunity in terms of how we can impact the healthcare delivery. Now, when you have many illness and seeing 11 different providers, it's really hard for any provider to see a big picture. And this is one of the values that as health plan, we could provide in understanding, creating a comprehensive profile of each patient. For research and analysis purposes, obviously the claims data will help us understand greatly how we could measure various program impacts and outcome. And with the 1.6 million members, it really allows us to develop even retrospective propensity weight analysis, not just randomized randomized trials. So many studies that we get asked to participate, collaborate, they are not starting with a random control group and intervention group. But having 1.6 million members, that allows us to retrospectively create similar control groups so that we could evaluate some of the interventions or programs in a retrospective manner. There are two collaborative researches that Blue Cross has done with Tulane. One is with Dr. Li Jingxi, who was evaluating our quality blue programs. That was a retrospective study where we had to mine through our data and come up with propensity-weighted control group. Then there is another study with Dr. Kraussel Wood. Actually, this is more of a prospective control study looking at pharmacy medication. So the research opportunities do not have to be limited to clinical interventions. As John mentioned, we are trying to improve the lives and health of the people in Louisiana. Often health problems are more than science problems. Health problems could be information problems. In other words, it's about changing behavior. So in addition to clinical interventions, we are able to understand or study member behaviors. So it could be, how do we engage members more so that they are seeing doctors more often rather than waiting to go to ER? Or it could be, how can we inform our members that they need certain preventive care or certain chronic maintenance measures being done? So it could be monitoring glucose levels or developing health lifestyle, or it could be just having a primary care physician. So many research topics actually could include not just on the actual clinical outcome using clinical protocols, but applying what we know in the science and making sure that gets done, whether it's through physicians or through our members. So I think there is a definitely great opportunity beyond just public health or school of medicine. It is about changing one's behavior, something that marketing does all the time. So in the research breakout session, I'm going to talk about some of the specific data elements we have. There are some raw data elements. Also, we also have sophisticated clinical rule applied data elements that may be helpful. So I'm hoping that this afternoon discussion will have some engaging discussion that'll help us find opportunities where we could collectively make impact on the lives of the Louisiana people. Now, let me introduce Dr. Rob Muscalis.
As the medical director for Care Transformation, I have a variety of roles, but one of them is attending employer meetings with our sales team and our account managers. And my role in those meetings varies, and it primarily deals with helping employers understand what the cost drivers are for their organization, and then providing insight on how they can positively impact both their clinical and their financial risk. But it also includes discussions about our value-based programs and why we as a health plan and why many health plans across the country are moving away from routine increases in our fee schedules and instead moving toward reimbursement models that provide reimbursement based upon how well providers perform. In other words, how well they take care of their patients based upon the results, clinical results of the conditions that those patients have, along with how well they're doing with regard to saving healthcare dollars. And I have to tell you, the meetings are very interesting. They're all different because all employers are different, all employee populations are different, but many of the questions that I get from the employers are the same, and I want to give you a few examples. For example, why are my costs so high, and what can I as an employer do to help control my healthcare costs? Can you explain to me how your care and disease management programs, along with your wellness programs, work? Do I really need them as an employer? Are they a wise investment? And if so, why are they? And then recently, over the last year, well, if this is a program called Shared Savings, how come I'm the one writing out the check? So we're hard-pressed to show them data and analyses that in fact shows them the value that comes with these new programs. I have to tell you also that employers and their consultants have become very sophisticated, and frankly they should, because the healthcare system is very complicated, it's becoming more complicated, and it's difficult to understand. Even for those of us who are in it and have been in it for 20 or 30 years, it can be very difficult to understand. I also want to point out, and many of you already know this, that for many employers, healthcare costs are probably the second highest budget item that they face each year, next to salaries and benefits. You know, more and more employers are not just looking for data, but they're looking for information. They want us to analyze the data that gives them the information that they need in order to make important decisions about their budget that ultimately is going to affect their company's bottom line. But I also want to point out, it's not just about the cost of health care. Employers also need a healthy workforce. Absence costs, things that are associated with workers' comp claims, short and long-term disability, FMLA absences, those indirect costs can sometimes represent 2 to 3 times the direct health care costs that a company experiences. So a healthy workforce is equally important to an employer's profitability. As I said, we're constantly being asked for data analysis to help drive decisions for our customers. And a partnership with Tulane provides a great opportunity for us to combine customer needs, healthcare data, and Tulane's expertise in both education and research to find solutions to problems that are related to healthcare cost, quality, and access. Dr. Foreman, you mentioned you've been here 6 weeks. I just had my 1-year anniversary here in Louisiana, having migrated here from Pennsylvania. Now, John started out pointing out about the variety of healthcare issues that are faced by Louisianians. But I want to tell you, as someone who's come here from Pennsylvania, while Louisiana has its healthcare issues, I have met so many warm, friendly people, and there's an atmosphere in the state of Louisiana that I find very welcoming, especially from someone from the north. I also want to point out that recently, with the flooding that we saw in Baton Rouge, I saw how communities come together, how friends, families, and neighbors can come together, and when they're focused on getting a job done, they can get it done. And what I've seen happen locally for our community in Baton Rouge just makes me even more confident about the type of results we can see from a partnership between Blue Cross and Tulane. When we focus our efforts, when we identify where we ultimately want to be, we can achieve great success. And I want to compliment all of you as Louisianians on that. I now want to turn the podium over to Kim Kacherka, who is the director of our Blue Cross Learning Institute. Thank you very much.
Thank you for the introduction, and good afternoon, everybody. I'd also like to thank you for having us here today. This is very exciting for all of us. I am very much looking forward to this partnership for a different reason, a little bit different than everybody who has spoken before. My angle is a little bit different, and what I'm going to be presenting out there is a partnership between us. At Blue Cross, my role is Director of Human Resources, and I am the leader there of the Blue Cross Learning Institute. What that basically means is I am accountable for talent management at Blue Cross Blue Shield. That means I have responsibility over a couple different things. Mainly, though, it's summarized as the attraction, the retention, and the engagement of our employees. As mentioned by John, we have 2,500 Louisianians, and we need to keep a steady pipeline of those Louisianians in our organization. My scope of responsibilities include a couple different things. I'm responsible for planning for our workforce at Blue Cross Blue Shield. I look for leadership development and responsible for developing our leaders for tomorrow as well as today. Learning and development, so I'm the one who's looking at capabilities needed for our organization, what capabilities are needed today, what capabilities are needed tomorrow. Talent review, looking at what capabilities we have and where those shortfalls are going to be tomorrow. Looking for high potentials that will fill our leadership positions. Succession planning to make sure those leaders get there. And then general organizational development, making sure we stay a strong organization in this state for a very long time. My job is to make sure we have a pipeline of talent. That's what it is. That's what it boils down to. So at this time, what I do know about Blue Cross, is it's a great place to work. It is a great place to be. I'll share just a couple things with you about Blue Cross as an employer. We're one of the largest employers in the capital area relative to size of our organization in terms of the sheer number of employees as well as our revenues. We have so much interest in folks wanting to work for Blue Cross Blue Shield. In fact, each year we receive about 25,000 employee applications for about 350 jobs. People want to come here. We have an incredibly high level of engagement. We have a survey that's done with our employees every single year. And on average, what we have seen consistently over the past 5 years is about 90% of our employees are satisfied with Blue Cross as an employer. That compares to a national comparison of about 78%. We also see that 90% of our employees are willing to recommend Blue Cross as a great place to work to their friends and their family, and that's compared to 76% in the normative population. We've also made the best places to work in Baton Rouge for the last 3 years. All 3 years that it's been offered, most of our employees are in Baton Rouge. About 90% of them are in Baton Rouge. This year we made the list. We were the 5th best employer in the Baton Rouge area. This could be a number of different things. Overall, it's the people, but we can also contribute it to our competitive pay, competitive benefits, our community programs, our community outreach, our wellness programs that are out there, including the on-site gym is a hit, and just really our overall culture. It's just a really great place to be. And being from the north as well, I concur with the previous comments made. It is just a feeling you have at Blue Cross. But the world is changing for us at Blue Cross, much like it's changing for many organizations. And this is where I see the partnership between Blue Cross and Tulane actually being a win-win situation. In recent years, all organizations across the country have been challenged by a significant and constantly growing skill gap. It's harder than ever to attract, retain, and engage the workforce. And this includes hiring the people with the right skills and experiences to be successful. The demographics of our workforce are changing. The millennials, as you know, are becoming a larger and larger part of corporate America. Right now at Blue Cross, we have a little over 1/3 of our workforce being millennials, and that will continue to grow. However, like many others in corporate America, we are seeing that the skills that these millennials are bringing into the workforce aren't necessarily what's needed to be successful. Many of them are coming into the workforce unprepared to meet the challenges of the positions that they're about to hold. Not all of that is their fault. Some of them are being put into positions because of a gap that we're seeing with boomers exiting the organization. But the reality is, we need further development of these millennials entering into the organization. We also know to be successful, we have to retain current employees. But the skills needed in corporate America are changing so fast. What we're seeing is that we have very dedicated employees, but as skills become obsolete and new skills are coming in, we're not being able as organizations to keep up with our current employees' needs for development. I heard recently, how many of you have heard about the corporate's war on talent, or the corporate war for talent? Okay, in corporate America, there has been a big war for talent, and whoever wins this war is going to be the biggest and the best organizations moving forward. And recently I read an article, and it mentioned that the war is over, and really, when it's all said and done, talent has won. Not the organizations, talent has won. And what we're seeing is a couple different things. We're seeing that people with key skills that are needed in today's organizations, those research skills, those analytic skills, they're in short supply, too short for the demand that's out there. We need more of them. Those folks with those skills are highly in demand. Companies are finding that the existing employees that they have are missing several critical skills and are struggling to keep up with making them learn and develop what's needed to move forward. Those organizations that can figure out new and innovative ways to continuously develop their employees through partnerships like today are the ones that will win that talent. Thanks to healthcare laws, employees are more mobile than they've ever been before, so we don't have commitment necessarily to organizations like we used to in the past. And the companies that cannot attract and retain those millennials are going to lose. And what this means is we need to create in corporate America new and different experiences for them that we've never seen before. But the good thing is you've all seen it in the work that you do at the universities. And you can be a strong partner in helping corporate America change to create those new, different work experiences that we're not used to in our standard structures. So this is why this partnership is really exciting to me. I see so much potential out there with a university, a top university like Tulane. It's going to help us make sure a pipeline is secure and we have the right talent at the right place at the right time moving forward. But I also think it's a two-way street. I think our help is for your students also exists. So during the breakout session that we're going to have right here, my colleagues and I that are here, what we intend to do is talk a little bit more about that partnership. Historically, partnerships with universities have been indirect. We've been at the college fairs. We've been recruiting your students, but it's kind of hands-off. We'd like to explore relationships with your university that's much more direct. And those are the strategies we'd like to explore with all of you during those breakout sessions. I think it's fantastic. I think it's wonderful, and I really cannot wait to start the process and start to hear some of the ideas and the thoughts and the innovative challenges that come out of Tulane and this partnership together.
It's been a long and winding road. We've been talking about this partnership for over 2 years. And it's taken a lot of support on both sides, from Tulane and from Blue Cross, to make this thing happen. And so the culmination of this partnership today, I think, is really a joyous occasion. I think it'll be mutually beneficial for our two institutions, but the true beneficiaries will be the citizens of Louisiana.
I'm excited to see our researchers getting in a room together with the folks from Blue Cross Blue Shield and start really working out what makes the most sense, what's really going to get some of those hard questions answered.
The benefits are to highlight the value that comes from bringing two organizations together to work together for a common purpose, both of them bringing expertise in various fields, but together they can work to use that expertise for the good and benefit of all Louisianians.